All right, well, welcome. This is Brian Hagan from Your HealthySteps. And the other, I'd say a couple weeks ago, we had an in-service with a group of doctors and dental hygienists. And so it was a very interesting in-service. I really enjoyed it. But one of the things I was thinking about was that there are muscles in the head and the jaw area that can cause some pretty significant, some pretty major pain in the jaw, in the teeth, around the mouth, around the cheeks, into the side of the head, on the top of the head. So I thought, well, hey, let's go ahead and do a video on two of these muscles, because these two muscles work pretty close to each other, but they also get very, very tight and very, very angry because of some of the modern day stuff that we do, sitting and clenching our jaws. So I'll explain all that here in just a second. The two muscles that we're talking about are the masseter and temporalis. So let's cover each one separately, and then we'll kind of talk to them about them together, and then we'll talk about some of the problems that they have. So obviously you can tell Mr. Manning here is pretty well covered in red and black and blue. The blue is the muscle, and the red is the pain pattern, and the blacks are what we call hyper-irritated points. So the black marks are hyper-irritated points. Okay, so the blue area is the muscle. And on this one, this is the masseter muscle. It's on both sides of our jaw. It pretty much comes right off of the jaw, right down here. It sort of starts right here, comes up, and attaches right on the ridge between your eye and your upper teeth, right? Right in this ridge right here. And you can sort of see that on Mr. Manning. That's the masseter muscle. Now, don't let that size fool you, because that muscle is not a very big muscle, but it's amazingly powerful. Because what does this muscle do? Well, it brings the jaw together, and parts of it actually pull the jaw backward. Well, brings that jaw backwards that way. But its primary job is to bring the jaws together, or to bring that jaw up, to elevate the jaw. And we use it in chewing, all right? And that's going to be a problem here, not chewing per se, but clenching the jaw here, all right? So that's what this muscle does. So let's move Mr. Manning around, see if we can get him around here without him falling over. Okay. And we see this muscle. This is temporalis. Fairly much bigger muscle than the masseter muscle, and they work together. So this muscle comes down and attaches pretty much right where the jaw, this part of the jaw comes up, right up in here. It attaches right there. You can see that on Mr. Manning, and then it comes up all the way up this direction, and then all the way up around the ear. It occupies this space right here. And you can see that on Mr. Manning. All right. And what does it do? Well, it works with Mr. Masseter, the masseter muscle, in bringing the jaw upward, right? When we're chewing and that type of stuff, bringing the jaw upward, but it also helps to pull the jaw backwards. Okay. All right. So that's what these muscles do. So what was interesting to me is two things. The masseter muscle, we can get people to get that relaxed by sitting, relaxing. This muscle would tend to chill down a little bit. The temporalis muscle didn't chill down or didn't relax. They were doing some electrodes and testing, and they couldn't get this muscle to relax as long as the person who was in the test was sitting. As long as they were sitting, this muscle back here, temporalis, was working. It was tight. They couldn't get it to release or to relax. Now, when they laid the person down or they got them out and started moving them around, this is when the muscle would relax. So in our modern day society, we're under a lot of stress, especially this period now, and we're sitting a lot. I mean, I'm certainly sitting much more than I have ever sat in my entire life. And when we do that, this temporalis muscle gets tight. It just seems to have a difficult time, or it's almost impossible for this muscle to relax. So there's always this upward push or pull on the jaw, bringing the jaw up, and there's always this tension all up in here. Plus, if we're in that habit of clenching our jaws, then the masseter muscle is going to get involved. And why is that such a problem? Well, because these muscles cause a lot of pain that we would associate with headaches. It's pretty significant headaches. And they can cause pain in the jaw. They can cause teeth pain and pain up into the cheeks, all eyebrows. So let's show you where those are at. Let's bring you back over here to the smaller masseter muscle, okay? And let's see if we can see this here. So this muscle, if you think about it, is right here. And on that period from here, or that muscle, that distance right there, there were 4 points on this muscle that when this muscle is tight and just constantly tight, can develop into hyper-irritated points called trigger points. And this one has 4. 4, that's amazing. Some of the bigger muscles in our bodies only have a couple. This one has 4. And those 4 muscles can create pain anywhere you see red there. So I don't want to go into each trigger point because each trigger point has its own pain pattern. I just want you to get the concept here, the variety of pain that this thing can cause. It can cause pain down into the chin, all along the ridge bone here, into the cheek, especially up near the nose, like up and around here, all the way back up in front of the ear, even in the ear itself, right there, right inside the ear. Can you see that? We can have pain inside the ear. So all along this whole jaw area here, the ear, front of the ear, and up into the temple and right above the eyebrows. So a lot of times we have that pain right up in here, we're just trying to get rid of it. It's not coming from here, it's coming from here. It's coming from the masseter muscle, okay? All right, so let's turn Mr. Manny around and we'll show you the pain pattern for temporalis, okay? Oh, and I'm sorry, let me bring him, the masseter, back around here. I'm sorry. Teeth. Let's bring this back here. So 2 of these, yes, 2 of these trigger points, the one on the top up here, these 2 trigger points right on the top, I don't know if you can see those, they're right there, very top part of this muscle. They can create pain in the molars on the top of your mouth. Those back 4 molars back here, they can create pain right in there, right on the teeth. And I was having an issue. I had some work done on my teeth, and for a long, long time I had this pain. Well, the work was successful. Everything was great. It was a root canal. I don't recommend those unless you need it. But I had this pain when I ran, and I just kind of associated it with the need of the root canal. But it wasn't. When that was gone, it was almost like this pain just wouldn't go away. Every time I run, I always felt it. And what was I doing when I was running? I was clenching my jaw. And when I clenched my jaw, I got pain right up in here, right there. That was coming from here. I started working on this. It's still not gone 100%, but it's a heck of a lot better. So I just thought it was interesting that it wasn't the root canal, it wasn't all that stuff. And I got a clean bill of health from the dentist, but it was the muscle that was causing a good part of it anyways. It's certainly going away, so I think I'm on the right path. But that is an interesting trigger point. People would never associate pain in the teeth with a muscle, and especially a muscle of the mouth, and it certainly can cause that. Both the I'm sorry, my mistake here. My mistake. One of those trigger points is the upper 4 molars back here, and the other trigger point is the lower, right there. And actually, I've got it marked on Mr. Manny. So the top, this trigger point here causes the pain on the top molars back here, and the back trigger point actually causes pain on the lower trigger, on the molars. So both upper and lower molars can be affected by this muscle. My mistake, sorry. I misread that. All right, so now let's go ahead and turn Mr. Manny around. And here we go. Temporalis. Now notice here a lot of similarities with our pain patterns here, all right? Specifically right up in here, all right? So temporalis can have 4 trigger points also. So again, between the 2 of them, that's 8 trigger points. That's 8 areas that get hyper-irritated, very common hyper-irritated, and can create all of this pain. So, can cause some pain, right? All right, so these trigger points here can cause pain. Now this one I know for sure is the top. I'll double check here. Yep, so these back molars on the top part, and as we get more toward what the incisors, I think they're like located right. They're not quite the front teeth, but they're the ones right next to it. I call them the incisors. I don't know, but they're right there. Okay, on Mr. Manny, they would be right here on me. We can get pain there. We can also get pain all the way up the cheek, that ridge right here on the cheek. We can get pain right above the eyebrows, pretty much the same exact area as the mastoid right here. Temporalis can cause the same pain. And now temporalis takes it one step further. It likes to take it into the head itself. So we can get pain right above the temple, like right up in here, the top side of the head, and the back part of the side of the head. So that's temporalis pain patterns right all in here. Oh, and one other interesting one, I hope you can pick it up, the nose. You can have pain right on the tips, or just this area right above the nostrils, right there. You can get pain there. That's a very odd place to have pain, but this muscle can create that pain. Okay, all right. So how do these two muscles work together? Well, they work together really in bringing the jaw upward, closing the jaw, and then pulling the jaw backwards. Okay, let's see here. How do we take care of this? Well, I'm a big fan of posture. When you're sitting a lot, we have to make sure that we try it as best as we can, keep our ears in alignment with our shoulders, in alignment with our hips. So when I stand up here, you can see my hip bone right here. So I would like to keep my ear in alignment with my shoulder, with my hip bone. When I sit down, that's where I want to do. That's what I want to do. I want to keep these straight in alignment. So I'm sitting more like this when I'm working on the computer. This is not an easy position to stay in, so you've got to set up reminders and I highly recommend setting up a timer that goes off every 15 to 20 minutes, and then you go from this to this, and then you get back to good posture, and then just know that you're going to sink back into it, and then the timer goes off and back up you go. All right? So good body mechanics when you're sitting and working at your computer is critical, and the more that we're working at home, we don't have those ergonomic people there to help us. So you've got to make sure that your workstation is proper. If you're working on the kitchen table or the kitchen counter or any of those things, you are setting yourself up for disaster. Okay, so make sure that you're in good posture. The other thing is we want to make sure that our jaws are in good shape, that we're not clenching our jaws. And that's definitely something that you can talk with your dentist. If it's muscular, they can get in, massage therapists can get in there and work on these muscles, a physical therapist. Those are good choices if it's muscular, to get those to release and relax. If it's structural, then that's definitely going to be something your dentist is going to want to take care of. Okay, so those are good things to check into. Make sure that you've got those under control. If it's just stress and tension, then it's just good to get in here, and you can do the massage. You can hire somebody to do the massage, or if you have a partner, they can do the massage. But really, it's just being creative. Don't be aggressive. Don't get into these areas here. Stay in the jaw. You can work the temples very gently, and then all up in here. But you can use the pads of your palm. Get in here and just work. Sometimes when I've been working and I feel like a tension headache is coming on because everything is getting tight, I'll do a heat pad, a microwave, a hot. I don't know what to call them, but just something to heat up, and I'll lay it up here. Sometimes I'll actually even put it up on top of my head just to kind of keep all this nice and loose, and then I'll get in here and just work it. So again, you just want it mediumly hot, moist. Place it up here, let this all get nice and warm, take it off, and then just work this whole area. And you'd be amazed at how much that'll help loosen this up. And then you keep an eye on it. A jaw clencher, or do I have my head forward? Those type of things. Be aware of it. But part of this is just knowing that these muscles can create these pains, and if we have some of these pains, or these are common, and if we get in there and work on it, if that helps, that's awesome. If it doesn't, then it might be time to see if it's something that you need a professional intervention, whether it's a massage therapist, physical therapist, dentist. But then that's a good place, the next direction to go. All right. I hope this is helpful. Have a great day and take care.